Did you know that a common mouth condition affecting nearly half of all adults may also be harming your kidneys? Most people think of kidney disease in terms of blood pressure, blood sugar, or diet. But new research is pointing to something surprising: your oral health. So today, we're breaking down how gum disease may affect kidney function, why the connection matters, and what you can do to protect yourself. And just a quick reminder before we begin: this video is for educational purposes only and is not medical advice. So let's get into it. When people think about gum disease, they usually think about bleeding gums, bad breath, or maybe loose teeth. But periodontitis, which is the advanced form of gum disease, is much more than just a problem in your mouth. It's a chronic infection that damages the gums and the bones supporting your teeth. It usually starts with plaque buildup along the gum line. Over time, harmful bacteria trigger inflammation, and if that inflammation isn't treated, it can progress into a serious infection. According to the CDC, nearly 47% of adults over age 30 in the United States have some form of periodontal disease. That makes it one of the most common chronic infections in the world. Now here's where it gets really interesting. When your gums are inflamed and infected, the protective barrier between your mouth and your bloodstream becomes weaker. That means harmful oral bacteria, including bacteria like Porphyromonas gingivalis, can enter the bloodstream. This is called bacteremia. Once those bacteria and their toxic byproducts get into circulation, they don't just stay in your mouth. They can travel throughout the body, including to the kidneys. And that matters because gum disease doesn't just cause a local infection. It also creates chronic inflammation throughout the body. In response to ongoing bacterial exposure, your immune system releases inflammatory markers such as C-reactive protein and interleukin-6. Elevated levels of these markers have been associated with faster decline in kidney function. Since the kidneys are constantly filtering the blood, they can be placed under extra stress when the body is dealing with long-term inflammation. Researchers have been paying close attention to this connection, and the findings are becoming harder to ignore. Several studies have found a significant association between periodontitis and chronic kidney disease, also known as CKD. In one large study published in the Journal of Clinical Periodontology, people with severe gum disease were found to have a higher risk of developing CKD compared with those who had healthy gums. Other research has suggested that treating gum disease may be associated with measurable improvements in kidney filtration. In other words, taking care of your gums may do more than protect your teeth. It may also support your kidney health. But here's something even more important. This relationship appears to go both ways. Poor oral health may contribute to worsening kidney function, but chronic kidney disease can also make oral health worse. People with CKD often experience dry mouth, changes in the oral environment, and a weakened immune response. All of that can make them more likely to develop gum disease. So it can become a vicious cycle. Gum disease may worsen kidney problems, and kidney problems may make gum disease harder to control. That's why oral health and overall health should never be treated as completely separate issues. So, what can you do? First, stay consistent with your oral hygiene routine. Brush twice a day with a soft-bristled toothbrush and fluoride toothpaste, and floss at least once a day. This helps remove plaque from between the teeth and along the gum line, where gum disease often begins. Second, don't skip regular dental checkups. Professional cleanings and early detection can make a huge difference. In many cases, your dentist may notice signs of inflammation or gum disease before they become more serious. Third, if you've been diagnosed with chronic kidney disease, make sure your dentist knows. Your dental treatment plan may need to be adjusted depending on your kidney function and the medications you're taking. And fourth, don't ignore signs of gum disease. If your gums are bleeding, swollen, tender, or receding, get them checked as soon as possible. Early treatment may help reduce inflammation and improve overall health outcomes. Most importantly, if you have kidney disease or any other medical condition, talk with both your physician and your dentist before making changes to your care routine. The big takeaway here is simple: your mouth is not separate from the rest of your body. Gum disease is incredibly common, but it may have effects far beyond your teeth and gums. And as research continues to grow, it's becoming clear that oral health may play a much bigger role in kidney health than many people realize. If you found this video helpful, share it with someone who might benefit from it, and subscribe for more evidence-based health education. Thanks for watching.